Hi, my name's Gail Garvey and I'm Senior Researcher at the Menzies School of Health Research. Today we're launching Discover TT, which is a collaborative research centre to improve Indigenous health outcomes in cancer. We're hoping that Discover TT will provide us with evidence and identify knowledge gaps in research and service delivery so that we can start to address these to provide better cancer care outcomes for Aboriginal and Torres Strait Islander people.
And I think it's a great thing for us to have an involvement with the Centre for Research Excellence in discovering strategies to improve cancer outcomes for Indigenous people. The first part's engagement, and that's what we do in research. Research is not done on people, it's done with people and in partnership with people. And what you've just seen in Gail's presentation is a fantastic example of development of the concepts around the Centre for Research Excellence that's about partnership and it's about working with government service providers, with community members and with researchers and other research groups. And I think that's really important. The days of researchers coming up with an idea by themselves and doing it to people are well gone, thankfully. And this is about trying to make a difference by trying to work with people. Indigenous and non-Indigenous researchers, there's a lot of work to be done in cancer. This is a fantastic example of a new focus on what largely has been an ignored area in Aboriginal and Torres Strait Islander research as a priority. It's the second leading cause of death for Indigenous Australians.
So I think that there is no doubt that there's clear evidence of disparity in outcomes in our Indigenous population, and it requires a concerted, concentrated, a sustained effort to ensure that we build on the evidence base and that we translate that into real outcomes for Indigenous Australians. And the establishment of Australia's first research centre, Discover TT, Research Excellence Centre in Cancer, is a real thrilling opportunity, I think, and it's my great privilege to be part of this meeting, if only this morning.
My name's Auntie Margaret Gordon. I'm a tribal elder. I'm a Mullinjali. I was born on Turrbal land here, but my ancestors come from Mullinjali. So I went to Melbourne in 18th of September in 2010. I'm the only little black duck there, sorry. All the other ones still white faces. But I gave them a little door opening to what Aboriginal people were suffering with breast cancer. And boy, was it a shock. I called my first partner, who I teamed up with, my sister girl. And she said, sister girl? And she comes from Mullen. And I said, yeah, you're going to be my sister girl. You and I are going to do a mother and daughter, or, you know, sister and daughter and cousins or whatever. And I'm going to call you my judge because that's my word for my young people, is judge. So she thought this was wonderful and we spoke about each other and we gave our stories and everybody was just talking about me and I didn't feel anything special. I was just giving myself out there, teaching them about our race.
Hi, I'm Greg Pratt. I'm actually the manager of Aboriginal and Torres Strait Islander Health Research Program out of the Queensland Institute of Medical Research, and I've been invited here today by Gail Garvey to partake and just learn a little bit about what's going on. At the moment, you know, I'm just having an opportunity to network with some people. It's a wonderful opportunity to see some people who are passionate and very knowledgeable about, you know, cancer and how it affects our Indigenous Australians. I myself am Aboriginal, a descendant from the Quandamooka people, the Nunakal tribe of Stradbroke Island, and I grew up in Laura with the Kuku Yalanji people. So it's very good to be able to be here today and actually experience this and hear, like I say, from a lot of people who are very passionate about, you know, what they're doing and also about making a difference when it comes to Aboriginal health.
I'm Joan Cunningham. I'm a professor at the Menzies School of Health Research and I'm co-leader of Discover TT, which is the Centre of Research Excellence. And what we're hoping to get out of the Roundtable is a place for people to connect, to talk about where we've come from and where we can go to and really establish a network to take us forward.
My name's Melanie Price. I'm a research psychologist at the University of Sydney and I'm also Executive Director of the Psycho-Oncology Cooperative Research Group, and I'm excited to be talking about POCOG today and how we can possibly work together to improve and promote research in psychosocial aspects of Indigenous cancer care.
I'm Patricia Valerie. I head the Cancer Epidemiology Group at the Men's School of Health Research. I think today is a great day. We're bringing together service, research, support services, and to work to talk about cancer in Aboriginal and Torres Strait Island people. And we are hoping to build more collaborations, both in the area of research and in the area of services. And so I'm really looking forward to more work that will be carried out after we do this.
I'm David Copley. I'm the coordinator of the Aboriginal and Torres Strait Islander Cancer Prevention Team for Cancer Council SA. This is a really amazing launch today, and the Roundtable is going to give us a chance to look at not only why our cancer is so high amongst our people, but also what we can do to try to bring it down. It's really important to look at not only why it's there, but the new techniques and how we're going to do it at a cultural level.